Welcome to today's press briefing. We have on the stage two doctors with us. Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. The two doctors will give you an update on COVID cases as well as HA's position. We start with Dr. Lee. As of today, a total of 2,183 patients are currently hospitalized for treatment, including 328 new patients, and among patients staying in isolation facilities, 530 patients are in isolation wards, 195 patients are in second-tier isolation wards, and also there are 645 patients in North End Town Hospital, Hong Kong Infection Control Center, and also 250 in AWE Treatment Center, of which 254 are new patients, and there are 5 patients in critical condition and 5 in serious condition. And among the inpatients, there are a total of 39 patients in critical condition and 32 in serious condition. And 9 patients in critical condition are receiving care in intensive care units. And among the 6 patients in critical condition, only 1 had 3 jabs, and 3 others had no vaccination record, and 2 others had 2 jabs. And among the death cases today, we've reported 14 cases, including 10 males and 4 females, aged between 43 and 97. 10 patients who passed away did not complete the 3-dose vaccine regime, and 5 of them did not have any vaccination record at all. So let me first turn to the 9 death cases, which we believe the cause of death to be related to COVID-19. A 93-year-old female patient had no vaccination record. She had arrhythmia and a heart condition, and she was transferred to a public hospital via the A&E units of the Queen Elizabeth Hospital from a private hospital on 18th of August. She tested positive, and she also suffered from arthritis, and we prescribed her with antibiotics. Her condition deteriorated, and she passed away on the 22nd of August. Second case, 87-year-old male, 3 doses administered with renal failure. He was admitted to Human Hospital on the 17th of August because of chest pain and other conditions, and he also tested RT positive and PCR positive, and he was diagnosed with pneumonia. His condition deteriorated, and he passed away on the 22nd of August. The third patient, 94-year-old male with DM records, and he was admitted to hospital with shortness of breath and a drop in the blood oxygen level. He tested positive for both RAT and PCR, and he was found to have cardiac infarction and high cardiac enzyme level. And we also prescribed him with drugs, and after his condition had deteriorated, his vitals fluctuated, and he passed away in the evening of the 22nd of August. Fourth patient, an 88-year-old male, no vaccination record. He had chronic breathing problems. On the 22nd of August, he was admitted to hospital via Prince of Wales hospitals, and he also tested positive for PCR and RAT. Upon X-ray examination, he was found to have pneumonia, and he relied on high level of oxygen support on admission to hospital. We also prescribed him with steroids and antibiotics, and without improvement, he passed away on the 23rd of August. The other patient, a female patient who had hypertension and DM, and admitted to her hospital on the 8th of August at Eastern Hospital. She was found to be unconscious with low blood pressure at home. The RAT result was negative, but PCR remained positive. Her condition was unstable, and she passed away on the 23rd of August. Sixth case, 80-year-old male with 3 doses administered. he had hypertension, and whilst at home he was found to be unconscious, and he also had shortness of breath. And on the 21st of August, he was taken to Prince of Wales Hospital. He tested positive for RAT and PCR, and we also found intracranial hemorrhage. He finally passed away in the afternoon of the 23rd of August. A 92-year-old male who lived in a home. Again, he had arrhythmia and he had the history of stroke. On the 12th of August, he was admitted to Queen Mary Hospital. He tested PCR positive, and because of shortness of breath and coughs, he visited the hospital. X-ray examination found pneumonia, and he also relied on 100% oxygen support. And on the 23rd of August, he passed away in the afternoon. The 8th case, 2 doses administered for this male patient. On the 9th of August, he visited a designated COVID-19 clinic, and then upon examination, he was suspected to have pneumonia. He was transferred to the A&E unit, and on the 9th of August, when he visited the A&E unit of Queen Elizabeth Hospital, the RAT result was found to be positive. On the 4th of August, he also tested RAT positive on his own initiative. And on the 23rd of August, he passed away in the afternoon after his condition deteriorated. 9th case, 87-year-old male who had the 2 doses of vaccine. He had a heart problem and hypertension. On the 23rd of August, he was admitted via A&E unit in Eastern Hospital. He tested RAT positive. He had shortness of breath and fever and coughs. And after being admitted to hospital, his condition remained unstable with low blood oxygen level, and he passed away in the afternoon of the 23rd of August. As for the remaining patients, we believed that the cause of death for these cases may not have anything to do with COVID. A 49-year-old female suffering from terminal stage breast cancer. She had had 2 doses. She was admitted to hospital on the 8th of August via the outpatient clinic of Truman Hospital. She tested RAT positive and her condition deteriorated. She passed away on the 22nd. A man in his 80s who had no vaccination record. He also had infarction of the pulmonary artery, and he was admitted to hospital on the 9th of August, and hospital screening found him to be COVID positive. He also had a enlarged heart and arthritis, a DM with poor compliance, and on the 23rd of August, he was found to be unconscious, and upon resuscitation, he passed away. 84-year-old male, no vaccination record, with chronic respiratory problems, and on the 17th of August, he was admitted to Truman Hospital. His legs felt weak, and he had a bump on his head, and upon examination, he was found to have ICH. At the A&E unit, intubation was administered, and his condition deteriorated. He passed away on the 23rd of August. Another case, a 93-year-old female with 2 doses administered, with a stroke history and dementia. Because of fever and coughing, she visited Prince of Wales Hospital on the 8th of August. Upon hospital admission screening, she was found to be COVID positive. And then on the 18th and 19th of August, she had RAT negative results, and the CT value was found to be over 30. But on the 23rd of August, she was found to be unconscious. She passed away. Finally, a 97-year-old male without a vaccination record. He also suffers from a terminal stage cancer. On the 19th of August, he was admitted to a hospital, UCH via A&E unit. He vomited blood and also had blackened feces. We suspected his case to be hemorrhage in the intestines, and he tested PCR positive upon admission. He was admitted to the medical ward, and then his condition deteriorated, and he passed away in the afternoon of the 23rd. Yesterday, 268 patients have recovered, including 247 who were discharged, and 11 patients found to be positive, with 14 identified as close contacts. 168 more HA staff have been infected, with 47 of them returning to their positions. And an announcement, because of the epidemic situation, we've announced phase 3 of the bed deployment arrangement. As we need to deploy more resources to take care of COVID-19 patients, we will continue to scale back non-essential services. At this critical stage of fighting the epidemic, we need the help of private clinicians to help receive COVID as well as non-COVID patients. Some private hospitals have done their best to help us, and we'd like to appeal to other private hospitals to receive more patients. As far as the arrangement is concerned, we need cooperation from the private hospitals as well as family members of patients. And let me reassure family members that patients will only be referred upon being assessed to be suitable by professional healthcare staff, and they will continue to receive treatment in a comfortable environment. And under such circumstances, patients who have been referred to a private hospital from a public hospital would only be required to pay the public hospital fees. And for those under the fee remission program, if they are transferred to a private hospital, they would be offered the same remission. We urge family members of patients to be cooperative so that they can be transferred to private hospitals and more beds in public hospitals can be released to receive COVID patients. More importantly, get vaccinated as soon as possible. And no matter how mild your symptoms are, if you are COVID positive, you should see a doctor as quickly as possible. And if you're above 60, you should get antiviral oral drugs as quickly as possible. For elderly citizens, we can reduce the chance of the cases turning serious or even becoming death cases by 90% if oral drugs can be administered within 5 days of onset. We should all do our level best to protect vulnerable groups, elderly and children, because if they're infected, the consequences can be dire. We understand fully that we've been in midst of the epidemic for over 2 years, and we have been trying our best to observe anti-epidemic and social distancing measures. It's been very difficult, but as the situation escalates, we need to be vigilant, and we should continue to observe social distancing and other anti-epidemic measures so that we can all chip in to fight the epidemic together. I'd like to take this opportunity to announce that we've identified a cluster in the Eastern Hospital. A 95-year-old patient was found to be COVID positive on the 21st of August upon admission screening. Upon contact tracing, we found 5 patients and 4 staff members positive. And they are now in isolation with, and their condition are stable. And we will continue with contact tracing. And we have also stopped receiving new patients. Now, in several public hospitals recently, we found some positive cases among staff. And upon contact tracing, we understood that they attended a wedding banquet on the 20th of August. And 4 of them are from one from Queen Mary Hospital, and also one from Princess Margaret Hospital, and one from Prince of Wales Hospitals, or Kwong Wah Hospital. And patient services have not been disrupted, but let me remind everybody to avoid attending banquets and meal gatherings because of the epidemic situation. And even if you need to attend these occasions, please wear a mask as soon as you've finished eating to avoid infection. That concludes my report.
We have positive cases of 7,677, and PCR is 2,934, and RAT is 4,743. And we have 207 imported cases, and PCR, among them PCR as would be 181, and 26 from RAT tests. And from the imported cases, including 82 were found in airport samples, and 46 is within the first to the third day from the quarantine hotels or testing centers, and 56 from the CTC in the 4th to 7th day, and for the 8th to the 10th day there are 23 cases, and most of them have a high CT value, and they may be positive cases. Among the 207 cases is in 38 places, and for the following places they have over 10 cases. In India 32, the States 31, Philippines 19, the UK 18, Singapore 15, Thailand 14, and Nepal is 12. And the rest of the countries have less than 10 cases. We have 14 death cases today, as mentioned by Dr. Lee. And in the 5th wave, the total death cases is 9,421. And in our homes, and for 9 cases on the elderly homes, and for disability homes, there are 6 cases. And for Dakbo elderly centers, there are 4 residents who tested positive. And Shanghai Jinggok elderly homes, they have 1 resident tested positive, and 32 have to be tested. 基督教仁伯慈善基金景林 elderly home, we have and 2 residents have been tested, and in Tonghua Hospital Groups, Chang has 1 positive and 1 resident tested, and for home in Shangshui is 1 tested positive and 3 have to be tested. Tonghua Group of Hospitals, Weifang Elderly Home, 6 among them 6 have been tested and 1 tested positive. Hin Lei Sao nursery homes, and in Shamshui Po, and 1 resident is positive and 10 have to be tested. And Hong Yip home, they have 1 positive and 5 have to be tested. And Wu Lo Lok, the home there, 1 have to be positive and 6 have to be tested. And for Qi Yan Ji Ga, 1 positive and 7 have tested. In the Jockey Club home in Yunnan Hipway, 1 positive and 2 have to be tested. In Lok Kwan Ji Ga, there's 1 positive and 3 tested. Chen Zhenha Yi Shui Hin Disability Home, there's 1 positive and 5 have to be tested. Caraters Lok Yan Hin home for the mentally disabled, 1 positive and 7 have to be tested. And Yanchai Group of Hospitals, Kong Lai Sukse, there's 1 positive and 2 have been tested. And for schools, today's Wednesday, and we have 72 schools with 101 cases, 74 students and 27 staff, and 42 are from kindergartens, and 16 are from primary school, and 13 secondary schools, and 1 for special schools. And 27 schools have reported 2 or more cases. And we have recommended for several schools to suspend class for a week. The first school is in the Southern District. It's the Montessori International School. It's class Euphrates. Is among grades 46, and 24 students out of them have been tested positive. Among 24 students, 7 tested positive, and 2 more have been reported today. They have suspended class for a week. And in International College Hong Kong, and for 11.1 class 11.1, they have 2 positive among the 10 students, and they suspend class for a week. And 真理會學校 school, they have to be 2 positive in 20 out of the class of 20 and suspend class for 1 week. Victoria, South Kindergarten, K1A, 1AM class, and among the 27 students, there are 3 positive. And it's 1 student, 2 teachers, and in that class will be suspended for a week.
Previously, we suspended the classes of 2 schools, and now new cases have emerged, and some other classes will have to be suspended. The 學資源幼稚園 in 星月海日 previously, PNA and PNB were suspended on the 19th of August, and now K1B, in which are 29 students and 3 were found to be positive, and we've recommended the suspension for 1 week. Another school, Stanford American School in Kowloon City. Earlier, 7RENR was suspended. There were 6 students, and that was a class in the secondary school. Now for the primary section, 2RXIO class, 9 students, 2 found positive. So we've advised this class to be suspended for 1 week as well. As for subvariants, as of the 21st of August, the Public Health Laboratory Service received specimens for genome sequencing analysis. Now, for suspected BA.5.4 cases, the percentage now stands at 40.8%. For BA.2.12.1, the percentage is 8.7%. So the majority of cases are BA.5 cases. It has overtaken others with a rapid surge, and now we have a surge in the number of confirmed cases. Especially, we have 7,000 cases recorded today, with a rapid surge in BA.5 substrain. This could be the reason why we see a rapid increase in confirmed cases. So it is not impossible that we could reach 10,000 cases a day. Now, in other countries, with a climb in the cases of BA.5, the percentage could rise further. In Hong Kong, the percentage now stands at 40%, but because of the high transmissibility, the caseload could be higher. May I appeal to everyone to be vigilant and avoid gatherings and avoid crowds, and remember to wear a mask. And if you need to take part in group gatherings, well, of course, you should avoid meal gatherings. But if you cannot avoid them, please be vigilant. And if you have had contact with any confirmed case, you should get tested, and before you get a result, you should avoid going about or carrying on with your activities. If unfortunately you have had a meal with a confirmed case, and if you've taken your mask off, you should pay attention to your own condition and get tested, perhaps more than once. And you should be on guard because you're still in the incubation period, and please refrain from taking part in group activities, and please make sure you wear well-fitted masks, or perhaps you can use 2 masks. Also observe hand hygiene. We have many cases, so we may not be able to perform contact tracing for each and every case. We appeal to the public to cooperate with us. Basically, we would focus on contact tracing work in some facilities and homes, such as elderly homes, when there are outbreaks. As for the general public, please work with us. If you know you've taken part in some high-risk activities, for example, if you've been with an infected person just 2 days before onset, you should get tested as quickly as possible, especially when you didn't wear a mask. And whether it's RAT positive or PCR positive, you should make a report as quickly as possible, and you should make sure that the particulars you provide are correct. Say, if you visit a community testing center, you provide a telephone number, and you need to make sure that the telephone number as well as your ID card numbers are accurate. We rely on this information to do contact tracing. So if you are to make a report, please do it accurately. Every now and then we receive inquiries about a positive case not receiving an isolation order. Or sometimes it has to do with incorrect telephone number or incorrect Hong Kong ID card number put in whilst making a report. And sometimes it would take a lot of time in going back and forth and making corrections. So when you declare your case online, please make sure and double check your particulars before submitting the report to us. And the HA will also get hold of the particulars so as to provide follow-up treatment to the infected persons. If you're under home isolation, you should observe the isolation requirements as much as possible. You should stay in your room and not to go about or mix with your family members, and you should have separate meals with them. And if for some reason your home is not suitable for isolation, you should honestly make this report and go to an isolation facility so as to prevent your family members from being infected. You should also observe the red amber code system. We're still seeing an upward trend as far as caseload is concerned. We'd like to tackle the epidemic with precision. At the same time, we're concerned that the hospital system will be under pressure. And if the upward trend continues, the government may consider tightening social distancing measures. It is inevitable. So this would inevitably affect the daily lives of many people. So please try to be cooperative and observe social distancing measures and reduce social activities. The floor is open. Please introduce the media outlet you represent before you speak. I'm from Cable. Good afternoon. I'd like to ask about the wedding banquet cluster of Hospital Authority. Is service to patients disrupted, and about the doctors and healthcare staff affected by the cluster? How many staff members are under quarantine? How many people attended this wedding banquet? And what level of caseload are we talking about if we are to tighten the social distancing measures? We have 7,000 or more than 7,000 cases recorded today. What is your assessment of the peak? And also on isolation, what is our strategy? Do we have sufficient isolation facilities? And would home isolation have the same effect as isolation facilities? Our preliminary understanding is that the infected persons attended the wedding banquet on the 20th of August. For the Princess Margaret Hospital, the doctor who worked there got infected, and he is a pathologist, and we are now conducting contact tracing, and so far no patient has been identified as close contact. I don't have other information regarding this wedding banquet. At present, we see an upward trend. We don't know when it will plateau or go down. But judging from the upward trend at the moment, we don't rule out having more than 10,000 cases a day in the near future. I understand that the government, the Health Bureau, will continue to review social distancing measures. Of course, tightening of these measures would not be done casually. We need to keep in view the hospital authority situation and see whether the system could cope with the influx of cases as well as other factors such as the economic factor.
你好 AM 730，想問病人嗰方面。
AM 730, gentleman on the left and the back. Do you have the update on how many patients are there on the AWE? And for private hospitals, how many patients they have received patients, and how many private hospitals have got involved? And what about the total number of beds that are provided by the private hospitals? And as mentioned by Dr. Chong, you mentioned about the trend for the pandemic. Seems the measures you're now appealing to us quite different from those in the second and third wave, and for the we notice the variant now is 0.4, 0.5, and is it because of the difference of the variant that the measures are different, or there are different reasons that account for the difference in the measures that you want to take? And what about the effectiveness of the current measures? How are they effective in coping with the current epidemic? And in Shanghai Jingguo, that homes, we know there are a number of cases. There are 1 infected and 30 being quarantined. So I just used the words to avoid participating in gatherings. I just used that word. But after all, the core of the message is for you to avoid going to the gatherings. And what I can do is only to appeal to you not to attend those gatherings, but it's not it's not compulsory. You can still go out. So I can only appeal to you. And for the CTN, in the past, there are some many infections within same buildings, and for the cases that arise from buildings now, there are also a lot of them are within the same buildings. So I hope those cases can be put in quarantine as soon as possible to avoid the spread. As for the situation with private hospitals, the total number of beds is 360, and till today 5 p.m. we have 167 patients that are in private hospitals. There are non-COVID cases, and for the TMHK Medical Center we have 24 beds and we have 22 patients being put in there. And for the total number of patients being transferred to private hospitals are 473. And I perhaps missed your first question. Can you repeat? Speaker is off mic. As for the Asia Expo, until 9 a.m. today, we have 20 patients there, and 2 patients were later discharged. And 28 patients have been received by the Asia Expo. Because now it's towards the evening and before the weathers get too bad, we can arrange more patients to be transferred to there. And from my estimates, there are maybe a handful of patients being transferred there. And for Phật Cao Liên Quốc Tinh Sẽ homes, we have 1 more resident and 1 more staff member being reported as positive today. And in the whole floor, there's 32 residents there have to be tested. A gentleman on the right for the next question. From now. The kindergarten cases are also on the rise, and those who are aged 20 years old or below, they cannot wear masks. So now it's near the start of school year. Would the play groups and the kindergartens be suspended? And we are aware of the increasing proportion of kindergarten cases, and because primary and secondary schools are now on holiday, and because the kindergarten holidays are shorter, so that may account for the rise in proportion of kindergarten cases. But in the kindergarten, they may have smaller class sizes. So if they have 2 or 3 students in the class that is tested positive, we would recommend suspension. But we want to minimize the disruption to their classes as much as possible. Final question. The gentleman on the left from Ming Pao. I want to ask Dr. Chong. You said the COVID measures may be tightened, and especially when the cases rise above 10K. And looking at the 4th stage measures that you prepare, you can take 1,400 patients per day, so you can take a case number of 30,000 perhaps. So if you say you now have to tighten the measures, is it too early to say that? And for the wedding banquet cluster, the total number of staff members infected, how many? And the HA have issued guidelines for staff member to avoid going to banquets, and any follow-up measures or even penalties would be issued to those who went there to the banquets. And for the homes, how many of the cases are caused by the staff members, and how many are suspected cases and re-positive cases, or cases that just tested positive, and how we deal with the staff members, the situation there. And for the wedding banquets, I would first give a response. And we have 6 doctors, medical officers who have been tested positive. And perhaps if I have news later, I'll update you on this press briefing or through other channels. And for follow-up measures for those who attended the banquets, we would be, well, of course, we follow up on that, but we also trying to be understanding, as our staff members also have their own lives outside of work, and they have social gatherings to attend to. But we can just remind them and appeal to them, if they are going to attend gatherings or banquets, they have to maintain personal hygiene at all times and keep social distancing. And for the 4th and the 3rd stage of measures, if the case rises above 10K, because the hospitalization rate currently is at 4 to 5%, and if the case number is continually on the rise, we expect the hospitalization number to double in future. So if we adopt the 4th stage measures, we may our capacity may be maxed out. But we also have 2 difficulties. First, we may have to deploy some non-COVID beds to deal with the COVID cases. But we know also the non-COVID cases, they also have high demand for treatment and beds. And especially when winter are coming, the demands would be on the rise. And if we open more social quarantine facilities, that may take up our manpower. So these are the 2 constraints that we are faced with to scale up our measures. As for the responses for the homes, especially in elderly homes, because the elderly there, the residents there, they usually just stay within the centers, and of course the elderly and the staff members, they can do RAT, but usually the cases may be brought in, the virus may be brought in by the staff members. So we want to detect those cases as soon as possible, because the staff members are those who go in and out of their homes, and the residents usually just stay inside. And the residents also have lower weaker immune system. They be more susceptible to serious or critical cases or even deaths. So we have to enhance our protection for the residents in elderly homes, and any risk for infection of them should be eliminated as much as possible. I don't have the exact numbers of the number of outbreaks or cases that are caused by the staff members of the homes. It's hard to say sometimes, because even we have residents being tested positive, they may be infected by virus brought in by staff members. And for positive cases, they are handled in the same way as the newly positive cases. So it's been consistent throughout. This is the end of press briefing. Thank you.